name's Arthur Rideout. I'm a plastic surgeon at the Janeway Children's Hospital. Plastic surgery is essentially reconstructive surgery, that is putting the pieces of the puzzle back together after somebody's had a misadventure.
My name is David, and I'm a plastic surgeon at the Janeway. Contrary to what most people think, it's not all about cosmetic surgery. It's usually about reconstructing and trying to restore what we would consider normal form or normal function.
Children need plastic surgery because they're children. They have accidents. I tend to fix a lot of hands and faces.
The children are born with things that aren't quite right. For example, plastic surgeons repair cleft lip and palate. They repair ears that are abnormal. It could be that the child has too many fingers, too few fingers, fingers that are fused, thumbs that are duplicated. There's any number of congenital anomalies that plastic surgeons deal with.
A challenging part of my job is that it relies on a lot of the pieces of the puzzle still being there. And if too many are missing, then you can't make it perfect. And that can be a real challenge. Usually it's a good result, but again, it relies on having a lot of the pieces of the puzzle there.
Benjamin's a little boy is born with a bilateral cleft lip and palate. He's had a fairly advanced form, a very severe form of the disease.
So, are you going to let me look in your mouth today?
Through a number of preoperative manipulations, with the assistance of the cleft palate team, we've been able to bring that back down. And then with surgery, we've been able to restore the contours of the upper lip.
Aaron was a typical 12-year-old boy over in Belle Island, and he was involved in an ATV accident. Nasty one, involved his leg, where trauma and there was exposed bone. We all put it back together.
Can you feel me touch your toes?
Yes.
What about this one?
Yeah.
This one? This one?
Yeah.
And your baby one?
Yeah.
My role in it was several ones. We try to move muscle around it, that is locally, but eventually we did a special operation where we take a piece of his stomach, that is the muscle in his stomach, and transplant it down with microsurgery to his leg to cover over the bone. What that does is it allows the bone to heal such that he can walk again.
Jen is one of many children we often see following dog bites. She's a lovely young lady who went to pet a stray dog that was not restrained, and unfortunately the dog bit her on her left side of her face. Initially I was a bit concerned I was going to lose part of the cheek because the tissues were undermined. But fortunately we took her to the OR that night and put the tissues back together, and it's healed well. The best part of plastic surgery is being presented with a child with a problem, figuring out what needs to be done, doing it, and then seeing the child and the parents and the look on their faces when the problem has been corrected.
There's a special moment, usually with a more dramatic surgery such as a cleft lip or palate. And you return them with the lip put back together. And there is that moment when they, not really sure it's their baby, but then they look in the eyes and they know it's their child. And that's always a heartwarming moment.